Hello, everyone. Thank you for joining us today. Let's just give a second. More people are joining from the waiting room. And okay, I can see some people joining. So hello, everyone. Let's just give a moment and we'll be starting. Thank you, everyone. And let me share my screen and we can start. So nice to see you all. Thank you for joining. We are still receiving some more people from the waiting room. Let's see who else will be joining us today. Okay. Let's open the room so that everyone can join. Okay. Okay, people, everyone, please say hi in the chat. And our checking question for today is share the name of some mentor that you are thankful for, that you are grateful for. Please, let's put the name. Let's put the name of someone that we are thankful for. Let's see some names coming. See, I can see people. Thank you. People are mentioning some of the people in the room. Thank you. Maybe there's someone back home that you are thankful for. Please, let's write in the chat the name of someone that we are thankful for. And I will pass it on to my colleague Nahad so that we can start the session. Nahad.
Good morning, good afternoon from Washington, D.C. I'm filling in for Elizabeth Guthrie, who's the project lead for this innovative series. My name is Nahad Sadrazudi. I'm currently working as a consultant to this initiative. Today's session, thank you. Today's session, which is the sixth one out of the 7-part series, is focusing on healthcare worker capacity building, tracking and recording, as well as, I think you moved a bit too quickly for me, integration. Thank you. And then the agenda, as you have in front of you already. Yeah, maybe I'll give you a cue, Sam, to go to the next slide. That might be easier. Okay. So the agenda. So here is the agenda for today, and we can go to the next one, please. The next 3 slides cover a quick overview of our esteemed colleagues who are one way or another covering these or supporting these sessions, starting with the project lead, followed by our wonderful facilitators, as well as our world-renowned experts, technical advisors who are supporting this this series. As I mentioned, this is number 6 now as part of our 7-part series. So this is just to contextualize the journey that we've been on. Going to the next slide. A very quick review of session 5, which was the last session led by Lucy, who did a fantastic job of covering very complex topics in a very short amount of time. But of course, that's supplemented with a self-paced course that you all have undertaken. We covered some important topics around evidence generation as part of our informed decision-making, financing considerations. And of course, there's the role of advocacy that goes into this effort. And of course, that was supplemented, integrated with wonderful work around relationship building and the different layers involved in advocacy and community activation vis-a-vis relationship building. Next, we can go to the next slide, please. Just very quick takeaways. There are 3 important topics that will be touched on in today's series, led by Dr. Haddison. The first part is really around integration. It's the work that we do around Life Course series is often maximized when it's integrated into existing infrastructure, whether it's system-wise or topical. Then it's around also making sure that we are building the capacity of our healthcare workers as we venture into Life Course immunization, to make sure that we're building their technical and adaptive capacity to support Life Course immunization. And of course, usually there is some implication on data tracking forms and processes, which is often an afterthought, but that should really be considered at the very beginning of this journey. Okay, I think with the next slide, I would be introducing our technical implementation expert, Dr. Haddison Eposi, which will be covering the HPV vaccination in one of the health districts in Cameroon. Dr. Eposi, over to you.
Hi, Nahad. Hello, everybody. Good afternoon. I am Dr. Eposi Haddison, and today I'll be talking to you about HPV vaccination in the Sahel district of Cameroon. So we'll look at the outline. The next slide. We'll have an overview of HPV introduction. We'll look at training of healthcare workers, integration with other services, and tracking data. Next. So Cameroon is located in Central Africa. As we can see on the map, we have 10 regions, 200 health districts. French and English are our official languages. Our capital is Cameroon, and in 2022, we had an estimated population of 27.7 million inhabitants. So the Sahel district, which is found in the center region of Cameroon, as we can see in the map, is one of 32 health districts in the region. So we have 11 health areas which cover 31 health facilities, and it's a rural district. And this year we had an estimated population of 76,961 inhabitants. So now we'll look at the HPV introduction. Next. So the HPV vaccine was introduced into our national EPI in October 2020, but we really started offering services as from November 2020. During week 3, we looked at the concept of burden of disease and choosing the right target population. So in our setting, cervical cancer is the second most prevalent female cancer, followed by breast cancer. And obviously we know it's vaccine preventable. So yes, the HPV vaccine was a good candidate to be introduced in our EPI. With regards to the target population, between 2020 and 2022, we targeted only 9-year-old girls. But as from 2023, this was extended to include boys with regards to the new SAGE recommendations. Next. Another concept we saw was for vaccine introduction, you have to evaluate the strength of your immunization program. And demonstration projects are a good way to do this. So several demonstration projects were conducted in schools for HPV vaccine delivery, and they were successful. So the government adopted this strategy along with vaccination in health facilities. With regards to dosing, between 2020 and 2022, 2 doses were given 6 months apart. But as from 2023, just a single dose was given based on the new SAGE recommendation, showing that the benefits got from 1 dose was equivalent to that, almost equivalent to that got from 2 doses. Next slide. So now you know that when you're introducing a new vaccine or a new strategy, you have to capacitate your health workers. So in Cameroon, especially for immunization, capacity building follows a cascade. They start with training of central supervisors and all the EPI regional coordinators. And then they train us, the district medical officers and the district EPI teams. Then now we in turn train our vaccinators and mobilizers in our different health districts. Now, what are the objectives when we go to train our vaccinators? Next slide. So the main objective first is for them to know the rationale for the new vaccine or strategy. Secondly, they are supposed to be able to identify the target group for the new vaccine or strategy alongside all the technical aspects of the vaccine. Then they're supposed to know how to manage data and obviously the key messages to pass on to the community to ensure adherence. Vaccination in schools shows that we are moving from the health sector to the educational sector, meaning we have to integrate our services with another system. Next slide. So school vaccination in schools is a very good example of integration beyond the healthcare platform. Today you saw, I guess, in the modules that you can integrate within the healthcare platform. I can also integrate beyond. So vaccination in schools is a very good example of beyond the healthcare platform. And why did we choose this strategy? Because it enables us reach our target population and obviously increase our coverage. Next slide. Another concept we saw was building vaccine acceptance and demand. Now, in our case with HPV vaccine, when it was introduced, there was a lot of hesitancy from healthcare workers, school authorities, parents, and I didn't put this here, even the Catholic Church in our region. Now, how did we come about, and these were our main stakeholders, how did we identify these stakeholders? Now, we had the vaccine. Who had to take the vaccine out? It's the healthcare workers. Where was the vaccine supposed to be administered? In schools. So school authorities were another key stakeholder. Now, when we get to the classes, who had to give permission for the children to be vaccinated? Their parents. So that was another key stakeholder. And another key stakeholder was the Catholic Church, because in our region, they actually told their followers not to take the HPV vaccine. So that was really a problem for us. And now the HPV vaccine too was introduced during COVID-19, especially when the COVID-19 vaccine too had just been introduced. So this really amplified mistrust in the HPV vaccine. Consequently, there was low demand from health workers. They didn't request for the vaccine from the district cold chain. And obviously the community didn't request for the vaccine in health facilities. So we had to carry out a lot of advocacy and sensitization. We held advocacy with school teachers. We carried out mass community sensitization using community health workers. And with the healthcare workers, we just had to continuously engage with them, telling them the benefits of going out to schools to administer the vaccine. So now, when you are introducing a new vaccine or strategy, you have to make sure that the tools you have are able to capture the data you'll be getting from the field. Next. So in a setting, when the vaccine was introduced, the electronic monthly reporting forms were updated, the vaccination registers were updated, but unfortunately, there were no vaccination cards. We didn't have consent forms. So what we had to do was to design an HPV vaccination card based on the COVID-19 vaccination cards we had. Next. So we did this, photocopied, and this is what we gave to, next slide. And this is what we gave to girls in schools when we went to vaccinate. Next slide. So we see from 2022 That's when the HPV vaccination, the infant vaccination card was updated to include 2 doses of HPV. Then in 2023, it was later updated to include 1 dose of HPV. Next, so here are some challenges we faced and the technical solutions we put in place. The first was for training. The training models were too cumbersome. So we had to pick out the key messages that were essential for the vaccinators and easy for them to assimilate. And the key thing here is you need to know your target audience, what they can easily assimilate. Secondly, as I just said, we didn't have all the tools and materials needed for introduction. So we had to adapt our existing tools. And lastly, the vaccinators complained that they didn't understand certain concepts and they didn't feel confident going to meet parents to talk about the vaccine. So what we had to do was to organize several training sessions based on the feedback we got from vaccinators and coverage. But then later on, I came to realize that this last challenge was actually vaccine hesitancy. They just didn't want to go out. That's why they were giving these excuses. Next. So here are other challenges we still face and the adaptive solutions we plan to put in place. The first is HPV vaccination is not fully integrated into the educational system. Yes, the government said we should vaccinate in schools, but then the schools have not put it in their program. So what we plan to do is to hold an advocacy meeting with the inspector of basic education for our district and ask him to inform school principals at the beginning, to inform parents through the school principals at the beginning of each year that there will be routine vaccination in schools. And the aim is that the parents will know that, yes, my child will be vaccinated in schools. Another excuse, or what's, I'm not saying excuse, what the school principals tell us and the school teachers is that they receive a lot of parental backlash when their children are vaccinated in schools. So what we'll propose to them is that hesitant parents should sign a waiver declining vaccination of their children at the beginning of each school year. And we put this because in Cameroon, parents are very good at saying, no, don't vaccinate, no, don't vaccinate. But then when you give them the consent form, they don't want to sign it. So if those consent forms are signed, will facilitate vaccination in schools. The next is vaccinator hesitancy. Till date, I still have vaccinators who have never vaccinated one child with the HPV vaccine. So we just have to continue engagement with them, talking with them about the benefits of going out to the schools in their catchment population to offer the vaccine, notwithstanding encourage the parents around them to bring their girls to the health facility for those who are not in school. And the last is time management, because the health workers complain that they don't have enough time to go to schools and vaccinate in schools. Well, I'll also say this is an excuse. They don't really want to go out and vaccinate. So what we plan to do is to organize a periodic intensification of routine immunization at the end of each school year. So that ensures that all boys and girls aged 9 for that year are covered in schools and also in the community for those who don't go to school. Next. So based on all the advocacy we have been doing since 2020 till date, as you can see on the graph below, in 2020, that year, we were not able to vaccinate any girl. Everybody refused. But as from 2021, still with the advocacy and sensitization, we're the sole district to organize a PIRI using the school strategy, which resulted in the highest number of girls vaccinated in the region. We're able to vaccinate 176 girls. And here we vaccinated between 9 to 13-year-olds. Now, in 2022, we didn't organize any PIRI, but that year we're able to vaccinate 109 girls, still 9 to 13. This 2023, We organized another period solely with local resources. And here, for the first period, we got funding from the regional office and the national office. But in 2023, it was just solely based on vaccinator engagement. They were motivated, they went out and they vaccinated with no funds, and were able to vaccinate 1,639 boys and girls, almost 50-50, aged 9 to 13. And obviously we had the highest coverage for HPV in the region during the first semester. So in a nutshell, I've just presented to you the three main topics we had today and the achievements we're able to accomplish with that. Thank you very much for listening.
Thank you, Dr. Kosi. Thank you. And let's give a round of applause for this presentation. Thank you. Okay, I see that there are some comments in the chat. Thank you. Please, if you have any comment or question, please write in the chat and we will take note of those. Let's move on to the next slide. Okay, so we are moving on to the next part of the session. We're going to talk about coaching, okay? And coaching, as we have briefly discussed in previous session and in previous moments, is a very important practice, okay? It's a very important practice, and it's a practice that we want to share with you in this session. But first, a question. I know that maybe some of you have already received some kind of coaching, right? So I would like to before we move on to that question in the screen, I would like to listen from you and hear from you. Who here has received some coaching in your life? And you can raise your hand or write in the chat, and we can see who has received some coaching. Okay, I see some people. Okay, thank you. Excellent, thank you. Okay, let's move our hands, take our hands down. Thank you, everyone. And one of the things is that this coaching that we may have received has different ways in which it can introduce and present itself, right? Maybe it's some coaching about a specific topic on our daily work. Maybe it's some coaching about other general topics about our life. But let's now go to this specific question. What makes coaching so relevant for life course immunization? And again, I would like to listen to some voices here. Let's see if you can, if you have some idea or some comment that you would like to make. What makes coaching important and relevant for life course immunization? And let's see, if you want to share your thoughts, please raise your hand and we can pass the microphone and listen to some of you. Okay, Elizabeth, please.
Good afternoon. So for me, life coaching means that you learn as you see a coach do certain things. And so what it means is that there is continuous transfer of information from one person to the other. And together, you can both learn from each other. If the coach is willing to also hear from the mentee in terms of their progress, in terms of where things are at. So that's what life coaching would mean for me. Thank you.
Thank you, Elizabeth. Fanny.
Yes. Thank you very much for this opportunity. I think coaching is very, very important because it's in the process of coaching that you identify the problems. And oftentimes, the solutions to problems are amongst the people that are experiencing the challenge. So when we listen to each other, we will be able to identify those challenges and find a way of knowing what they are doing in their circumstance to solving their problems. Thank you.
Thank you, Fanny. Thank you, Fanny. And before we go to the next person, I want to make a comment here because I think it's important that we at this point we mention this. So coaching, as we understand it and as we are going to share in the next few minutes, it's a practice that is different from just giving advice, okay? Coaching goes more into depth on the causes and what's going on our challenges, okay? And I would like to add here that when we are talking about coaching as a practice can be useful for three things, okay? So for example, coaching as a practice works really well when we are engaging and working with our communities, because in that way we can develop leadership in our communities and activate our people. A second thing is that we can also see coaching as a really important practice as we engage with stakeholders and as we develop relationships with them and support them. And finally, we can also see coaching as an important practice as we engage and work with our colleagues, with other immunization professionals, and as we do work with them. Okay. Asfandiar, please open your microphone.
Thank you very much. Is very rightly described by your good self. Immunization is a very challenging process. Like the demand creation, vaccine demand creation is the biggest challenge. And coaching is, for me, coaching is a very specific techniques which could be where you exploit the energies, you bring the energy in your workforce, which could come in effective way. So coaching is really important in the life course. Wherever there is vaccination, immunization, coaching makes a difference. It makes a big difference.
Thank you. Abu Bakar, please.
Okay, thank you very much, Dr. Sam. I think with me, if we look at the immunization practice in some years back, immunization focused mainly on children. But now the world is moving towards life course immunization. Most of the staff at the lower level that are giving vaccinations, their knowledge is mainly focused on the 5 immunization. And most of them don't have the opportunity to be engaging in this kind of trainings that will equip them with necessary knowledge to carry out the life course immunization. So I think coaching is highly related to life course immunization because the stakeholders at the state and national level need to be coaching the staff at the health facility level with all the necessary skills that are needed to implement the life course immunization. So I think coaching is very relevant to life course immunization because without the national and subnational staff giving coaching to the lower staff, they will not have enough knowledge to implement the life course immunization skills. So that's my take. Thank you very much.
Thank you. Adniu.
Yes, thank you. As mentioned previously by most of the participants, the coaching helps for both, for health workers, care providers, and others, especially for health workers. It gives opportunity to enable them to use every opportunity to reach out targets and to provide a vaccination. And also for care providers, it gives like confidence and enables them to get their children vaccinated and also use in many segments of the community, this coaching. Thank you.
Thank you. Now, one question that I want us to think about is what is preventing immunization professionals from doing work in life course immunization? And what I would like to mention some of the things that have come up so far. And I see some questions also in the chat about the main difference between coaching and other ways in which people can be supported and mentored. So please, let's write in the chat, what do you think are some of the things that are preventing the immunization professionals from achieving success and doing work in life course immunization? Let's please write in the chat, see some, and let's see some reasons, some reasons, okay? Finance issues, okay? What else? Capacity, okay? Security challenges, political challenges, lack of willingness, okay? Lack of understanding about its relevance, okay? The work burden, that's also really important. Time constraints, acceptance. And as we are seeing some of these comments in the chat, remuneration, social issues, thank you, misinformation. There, as we can see, there are different work overload, but we can put these different reasons in three main buckets. And I would like to mention these three buckets in the next slide. So we can put these different reasons in three main buckets. The first one is motivation. How maybe people are afraid or people are not very willing to change. So there is not a real motivation. And then that's a very specific thing that needs to be coached, right? Or maybe people are motivated, they want to achieve this, but there's no clear strategy, okay? There's no clear strategy, so then there's another type of coaching that can be done, coaching related to strategy. And the third one, maybe people are motivated, maybe people have a strategy, but they are lacking the skills, okay? They are lacking the skills. And that's why we are also able to coach on the skills, okay? Now, when we are thinking about which kind of challenge we are going to coach, we need to identify which one of these three buckets will be related to it, okay? And I can see that we are still writing some examples in the chat. Thank you for that. And as you write a reason, try to identify in which of these three buckets we are able to put our challenge. Is it a motivation challenge? Is it a strategy challenge? Or is there a skill challenge? Okay. Now there is a video, and I would like to see if people can see this video. Can everyone see this video?
Yes, I'm seeing it.
Okay, so let's see, there is this little puppy
You almost got it.
that is not sure of how
it's
to
okay.
go down the stairs.
Simon will show you, see?
And then there is another
See?
little dog.
Simon, go show her again. Go show her.
What is the big dog doing here?
Oh my God, I might cry. That's so funny.
Let's see.
You almost got it.
He's exactly, he's motivating the small one.
Oh, come on. Daisy.
Teaching and motivating the baby puppy.
Come on.
Good.
Come on.
Encouraging them, the small one.
Oh, sweetie. Simon's got you.
We can see how the big dog is supporting Excellent.
Yay! You're almost down. Come on.
And what's happening? The small puppy is able.
Good girl.
Give an example. Excellent.
Yay! Good job. Good Daisy.
Okay, so now let's move on and talk a little bit about the 5 steps. Okay, in this coaching as a practice that we are sharing with all of you, we want to mention that there are 5 key steps in this coaching process. And the first step on this coaching process is when you are with the person that you are going to coach, you need to observe and you need to gather information. Okay, you need to fully understand what's the need, what's happening, okay, and what is the best way to understand, what is the best way to gather new information. How can you gather new information from someone?
It's by listening.
Okay, very good, Fanny, thank you. Listening, and what else? Asking questions, thank you. There is in the chat, asking questions and listening. It's very important. It's a critical step of all this coaching process that you ask, tell me more, okay? Tell me more about what is that challenge that you are having. Then the second step, we need to have a hypothesis, a diagnosis, okay? Why is that happening? And we need to identify. I see this happening, and check with the person. Is this how you are feeling? Is this what is happening in your challenge? Okay. And once we have a clear diagnosis and we have a hypothesis of what's happening, then we can intervene. Okay. If we just give advice, that's not helping a lot the other person. But if we ask questions and we use these questions, and we can see people writing in the chat, asking questions, then this will allow the person that is being coached to start to think and to connect and to identify some new ways in which they can work. Okay, now once we are asking questions and we are making this intervention, we will be able to take some clear action steps. Okay, so we will be talking with our coachee and we will be asking them, what are the next steps that you are going to take? What are the next steps that you are going to do? And finally, and this is also important, we are going to check in. Okay, we need to identify, we need to find what are these clear next steps and when are we going to check in to see how those steps work out. So then the 5 steps, first of all, we will be observing, listening, gathering information, asking, tell me more. Then we will be able to identify in which of the 3 buckets this challenge is happening. Is this a challenge that is related to motivation? Is this a challenge that is related to the skills that the person is needing, or is there a lack of a strategy? Which one of these 3? Then we will make questions so that the person can identify what are the next steps. And then we have action steps and check-in. I see a question in the chat. How is intervening different from action steps? Thank you. Thank you for that question. So in the intervention, we are asking questions, okay? We are asking questions about what could be done. But then in the action step, we are making clear commitments. What are the clear commitments that we are going to do? Okay? So we have been sharing the 5 key steps, and I would love for us to practice, because practice is key when we are when we are learning. But before the practice, we'll just take a couple of minutes to see an example. So I will stop sharing my screen. And as I stop sharing my screen, I will ask my colleague Joyce to join me in the main screen. So okay, so we are having two examples in the next few minutes. And please, everyone, let's pay attention to these two examples because they will allow us to understand the difference, to see coaching happening, and then we will move on into the practice. So, are we ready, Joyce?
Yes, I am, Sam.
Okay. So, hi, Joyce. How are you today?
I'm very well, Sam. How are you? Good
Great.
to see you.
Thank you, Joyce. So you told me, Joyce, that you want us to talk about something. Is there a challenge that you have?
Yes, I wanted to talk about the challenge we are having with healthcare workers in relation to introducing the HPV vaccine. The problem we have is that they are fearing they don't have enough information on how to implement the new vaccine, HPV vaccine.
I see, Joyce. And actually, that's a problem that happens a lot. You know, that's a problem that happens a lot. People, sometimes they lack information, but people should be reading books. People should be learning more about HPV, because if people don't learn more, then there's no way this can be fixed. So what I think you need to go and tell people to learn more and to look for articles and for papers, and maybe even watch some videos, because when people start to learn more, they will be able to be less hesitant about these topics. I remember several months ago, I was having a problem like this with my team, and I just told them, you need to study and you will be able to learn more. So yeah, I think you need to do that, Joyce. I think you need to go. Do you agree with that, Joyce?
Sam, the problem is they feel like the vaccine was introduced too quickly to them. They don't feel prepared.
So they don't feel prepared. Okay. But I mean, you know, vaccines may take some time to be ready, but even then, Joyce, I think that people need to just trust in the process, and everything will be sorted out in the end, and everything will be okay, Joyce. I think we need to let people know that. That's what I will do in my team. Okay.
I don't know whether that is appropriate for my community, but I can try what you're telling me to do, Sam.
Yes. Please try that, and let me know later if it worked.
Thank you.
Okay, pause. Was that good coaching or bad coaching? And let's in the chat. Bad coaching.
I think it was bad.
I will say really bad. Okay, why was that bad coaching? Please.
You were providing solution.
I was just telling her what to do.
What to do? Yes.
You
Okay.
didn't take time to understand what was going on or the root cause of all this, and then you just kept on offering solutions, and you didn't take time to understand her, I think.
Exactly.
Yeah.
Exactly.
And also the diagnosis was not so elaborate. There was poor diagnosis of the case.
Very poor diagnosis. I didn't ask any questions. I didn't pay attention. I didn't observe. I didn't gather any information. So none of the steps was there. Okay. So that was a really bad example of coaching. And now let's move on to the second example. Okay, so Joyce, are we ready? Okay, we are on mute.
Yes, I am, Sam.
Perfect, so let's do. Hi, Joyce, how are you today?
Good, Sam. It's good to see you again.
Good to see you too, Joyce. Please, you were telling me that you had some challenge that you wanted to talk about. Please share.
Yes, it's the same challenge I had before, Sam. Our healthcare workers are fearing to give the HPV vaccine. They feel they are not ready, they don't have enough information, and they are being told to give this vaccine very quickly without having more information.
Okay, and I was wondering, have people received in your team information about the vaccine?
They did not, the healthcare workers say they are used to being prepared by their supervisors, by the Ministry of Health. Information comes to them gradually, and when they are ready to introduce the vaccine, then they start implementing. But this is very, very different.
Okay, so are you telling me that in the has the Ministry of Health been providing information recently?
Maybe they have provided the information, but it has not reached to the healthcare workers who are going to do the vaccination. So they are fearing what to tell the parents. And you know, with HPV, they have to work with children. They don't know how to engage with the schools or even the parents. They don't know what side effects that may come along with HPV vaccine. There are a lot of problems. There are areas, there are challenges that the healthcare workers need to be straightened before they can feel comfortable to start giving the vaccine.
Okay, Joyce. Another question: is there somewhere else besides the Ministry of Health where people can get this information? Is there some other place, some other source?
Sam, I think the healthcare workers need to be prepared. They need to be given in-service on HPV. They may need to have a relationship with the Ministry of Education and the schools, and of course the parents who are going probably to be very mean to the healthcare workers who are vaccinating their children without enough information.
Yeah, no, I agree.
And they need to talk about it, to have a campaign or some form of advocacy, so that when the healthcare workers go into the communities are already aware of what is going on.
Okay. Do you know, Joyce, if there is any other campaign or any other team that has worked similarly to this project of HPV in some other community?
There are other vaccines that have been introduced in the communities before this one, so probably we can borrow a leaf from that.
I see. And do you know any of these other teams that maybe they could share some of their experience?
Yes, I do know, and probably we can reach out to them. And the healthcare workers can, the supervisors can reach out to them, the Ministry of Health can reach out to them, they can work together with the, they need to map out who the key stakeholders are. They need to micro-plan to know where they are going to do these vaccinations. They need to work with other non-health sectors that could be involved in HPV vaccination.
Amazing, perfect. So then, Joyce, would you say that a key next step that you could do is identify these other teams and team leaders and put them into contact with you and your team so that they can share this experience and this knowledge?
Yes.
That will be amazing.
That's a good direction, yes.
That will be amazing. That's an amazing next step, Joyce, that you could definitely work with your team. And if I can support you in anything, that would be great. So let's see, how are you next week? Let's say next week on Friday around this time. Do you think we could be able to have a check-in meeting and see how is that coming along?
Yes, I'm available. It would be nice to brainstorm, and I can tell you a few of the things that the community wants to do.
Perfect, perfect. So then let's do that, Joyce. Let's meet next week and see how's everything coming along.
Thank you, Sam. I look forward to seeing you next week.
Thank you, Joyce. Bye-bye. Okay, so that was a second example. And let's see, was that bad coaching or good coaching?
Hi, Sam.
Coaching.
Hi.
Extremely perfect coaching.
Thank you, thank you. So there was great coaching, good coaching, and why? Because in this second example, questions were asked. I was able to observe, to identify, to check with Joyce, and to make sure that diagnosis was proper. It was not me giving advice. It was not me telling her what to do. It was asking questions, and by asking questions, there was a clear understanding of the needs, right? Okay, thank you, Joyce, for being part of these two examples. And let's go back to our slides. Okay. Okay, so share my screen. Okay. So, okay, that was our quick debrief. And our final slide before we move on to the practice. Questions are able to define and redefine the relationships between people, okay? So it's very, very important that we understand that questions are key. And not only that, but also coaching is an example of the practice that we mentioned in our first session. So getting on the balcony, okay? It's not only telling people what to do, is to put us on the balcony to see at the challenge and to ask questions so that we can find new ways of working with it. All right, so instructions for the breakout rooms. We will be putting all of you in a breakout room, and we will be sharing. Let me see. Okay. We will be putting you all in breakout rooms, and you will be able to have time to coach and to ask questions. Okay. Once you are in the breakout room, you will be choosing who will be the first coach. And then another person in that room will share what's a challenge that they have. Okay. And you will be able to ask 5 minutes of questions. And through those 5 minutes of questions, you will be identifying if this challenge is a motivation challenge. Maybe the team is not motivated. It's a strategy challenge. People may be motivated but have no strategy, or it's a skill challenge, right? So, for example, in this example that we just saw with Joyce, we were able to see how there was not a very clear strategy of the next steps, and that's why we discussed that we were going, like Joyce was going to reach out to other teams that have done some other campaigns to find some of these strategies and also to share that experience with her team. Okay, so you will be able to be sent to the rooms. Let me just make sure that the rooms are ready. Yes, Musa. Do you have a question? Musa's man?
Not yet.
Okay. Okay, so then let's create the rooms. You will be able to be in that room for 15 minutes and you will be taken directly to there. So see you all in 15 minutes. Hello, everyone. Thank you for coming back to the main room. And let's hear some voices, okay? Let's hear some voices, please. If you were able to have a conversation in your group, please raise your hand and share with us some of the experiences. Let's see who would like to share some of their experience. Okay, I see some hands coming up. Okay, thank you. All right, so let's see. Asif, please.
Yeah, thank you. Thank you very much. I'm from India, and we were 4 participants in the group. One is Tina. Tina was our mentor. I was the coach, and one from Nigeria, one colleague. So he had a problem of implementing HPV vaccination in his country. So first I coached him, but I missed some steps in the beginning, like listening to him properly, identifying the problem and diagnosing the problem. So I missed these 2 steps. I just jumped, since I'm working for a very long time in public health sector. So I thought that this is a thing that I should just directly suggest some few ways to intervene directly for implementation of the HPV vaccination. But later on, Tina was observing very minutely, and she explained at the end that the problems were quite different, because the problem was also related to the scarcity of the manpower.
Okay.
I just focused on the capacity building part of the manpower. The problem was related to the scarcity of manpower.
Okay.
The problem was related to the leadership and political will too, which I did not identify. So this was a great experience, that listening and in fact active listening to the problem or to the person is very important in any demand generation and communication planning. So we had a very good experience, and we learned from each other. And I found that these 5 steps which you told and which you spoke to us, those were very great. If we follow like that, that's a good thing. Yeah.
Asif,
thank you.
Thank you. So you were able to ask questions to each other.
Yes. We had a very good discussion.
Perfect. Thank you, Asif. Thank you. Okay, Aminu, please.
Yeah, thank you so much. It was actually a perfect and learning coaching session. We went through, I was being coached, and the narration and the issue and the challenge are based on the 5 steps. 1 is issue regarding vaccine hesitancy, accessibility and acceptance. We discussed on that. And the main issue around there, the challenges also highlighted was caused by communication gap, religious beliefs, and then poor knowledge of HPV vaccination. And the intervention we discussed, by is community engagement activities. That's the intervention we discussed. Town hall meetings there were organized. Then the champion of that is CBOs, though because the HPV vaccination involves religious and cultural discussions. In my turnout in my part of the country in Nigeria, is the most of the Muslim part. If you want to speak to people, you have to speak to their culture and their religion. They are so much connected and they are linked to each other. They are not separated. So we discussed on that, and I read the issue regarding that. And we discussed about how we have gone about it. So generally speaking, the step we follow in that discussion, I received coaching on the issues I raised, the challenges, and how to go about it, and action taken. Though in the mention and the discussion, because it was behavior modification, I suggested and mentioned that if you plan, you have to have a plan, of course, on the community engagement or other engagement, but you need to also make sure that that plan is being reviewed and recycled and implemented. If you plan to achieve in 2 weeks, it will not be possible. You have to go 1, 2, 3, 4, 5 before you reach the final destination.
I see.
I hope this a little contribution helped a lot in this discussion. Thank you. Over and out.
Thank you, Amino. Lucy, please share some of the experience.
Yeah, this is Lucy. I was the coach in the room. And maybe because I was the only girl or only female person there, so they chose me to be the coach. But notwithstanding, moreover, the topic we discussed was the non-compliant cases and how to resolve the non-compliant cases in a family of 3 that have under 5 children and refuse to take polio vaccine due to religious reasons. So my colleagues there gave me the insight how we can resolve that, which we have to involve the religious, because being in Nigeria, you cannot separate the religion and their belief. So we have to use the religious leader alone to be able to resolve it. Then another question came up again in the room, that if this is a developed country where they are so knowledge, they are so that they are refusing the vaccine due to one reason or the other. So the other coach, the other colleague from India brought that he had a live situation like that. They had to use the data to show them that this is the stage we are and this is where we are going. And when we refuse, this is what will happen. And that is how they were able to resolve that. Thank you very much.
Thank you. Thank you, Lucy. Obina, please.
Okay, thank you very much. So in my breakout session, I was able to be both a coach and also the person who will be coached. I first started off as being a coach. We had one of the facilitators, Adunola, who was there to guide, and we began very well. So I asked the questions and tried to elicit what was the problem. And, the feedback had to do with, knowledge around life course immunization being a new field. And I was able to guide those discussions using the 5, steps that we talked about, observing, diagnosing, intervening, and the action steps. And of course, we had somebody who was the observer, who after the end of that session was able to give feedback and did mention that all those steps were actually elicited and shown. And the reverse also happened when the other person, who was Michael Tomori, who now had to become the coach, and then I was the person to be coached. And of course, we went through the same questions, on the other way around. This time around, I was the one who provided the challenge, being about, adults not wanting to receive vaccines, that they thought that it was only children, and it had to do with something about them being more mature and didn't need help at that old age. He was able to provide some guidance. We were not able to have comments from the other person just before the breakout session, but that was where we ended. But we went through both back and forth on both sides. So it was good to see that. Thank you.
Thank you, Vina. And I am sorry, Victor and Adaora. We are almost on time. So please, if you could share in the chat your experience in your record room, and then we can come back to that. So thank you all. Let me share the last slide for the homework and for the next steps. And once we do that, we can wrap up the session and we can finish with our time for networking. So it was an amazing experience. I know that some people had some technical issues, but if you were able to have a conversation and a coaching experience, you will see the importance of asking questions and of listening, active listening. And in that way, through the asking questions and listening, you learn more and you are able to make and to allow the coachee, the person that is receiving the coaching, to learn more about their experience. So please take the post-session survey. You will be receiving an email, okay, with the post-session survey. Please fill that up. Also, we have our last Ed app module, the catch-up vaccination, missed opportunities for vaccination, and we have the post check-in of the Ed app course. So please take a look at those. We'll be releasing those during this day, and you will be able to answer those. And please go to the boosting community, to the Boost Community Learning Group, and please share a reflection about this experience of coaching, of asking questions, of observing, on diagnosing, and taking the next steps. Please remember that the recording and the makeup of this session will be available until Tuesday, because the Sabine team is currently on a holiday because Thanksgiving in the US. So you will be able to receive those recordings and those videos in the starting of next week. Please, the post-session survey, that's really important because that allows us to identify what are the needs and what are those things that we can improve for the next session. So having said that, we are really, really thankful with you all for being here today. We will be seeing you on the next session on Thursday, November 30. If you have any question, if you have any need of assistance, either with homework, with the platform, with anything, please send us an email at info@boostcommunity.org. Thank you all for joining today. And we'll be leaving this room open for another 15, 20 minutes if you want to stay in the session and chat and just like share with some of your colleagues. Please do that. We have seen people in the last few weeks being very, very active here. And we are very, very happy to see that these connections and these relationships are happening here, and that you all are getting this opportunity of learning, not only from the lecture, not only from the slides, but also from these interactions with your colleagues. So thank you very much, and see you next week. Thank you. Thank you all.
Thank you, Sam.
Thank you.
Thank you. Bye.
Bye-bye.
Bye. Thank you.
Thanks, Sam and Nahat. A lovely Friday tomorrow and a good weekend.
Thank you.
Thanksgiving.
Thank you. Bye-bye.
Bye.